And I'd like to introduce now Dr. Bruce Gellin, who is with us today with NVPO. Thank you.
Thank you, Congresswoman. Thank you for holding this important discussion today. And as you've already outlined, an important part of the country for this discussion. The National Vaccine Program Office came into being with congressional legislation in 1986 that identified that there was a need for general coordination of a very complex program. In that language, you outlined the range of things that needed to be within such a program that accompanied things you're going to hear about today, including vaccine research, vaccine development, vaccine safety and efficacy testing, licensing, distribution, evaluation, and importantly, the coordination of government and non-government stakeholders as well. Another part of that legislation asked for the development of a national vaccine plan, and in 2010 we updated our plan. And the timing for your roundtable today is perfect because we're now midway through a 10-year vision, and we're in the process of reevaluating what our priorities were then, and see how your vision for the 21st century cures fits well into that effort. But with this background, I want to just take just a minute or two to give you a few examples of some of the lessons we've learned and some of our current priorities about where we're going and how 21st century cures, particularly the vaccine discussions, can help. And I'll go back to the 2009 pandemic, for which all of the people who came from Washington today were on the phone and together probably most of the day for most of that time. And it taught us many lessons. One of them was the need to improve our production and improve the product itself. As Robin began to say, our mantra was more, better, and faster, and that really has been the driving factor for all of us in developing next generation flu vaccines. We also learned on the delivery side that we rely on everyday systems in emergencies, and therefore the need to continue to strengthen these everyday systems. And our seasonal influenza gives us an annual exercise to test those systems. And third, and I think Dr. Burgess particularly appreciated this, it was the importance of vaccinating pregnant women who were at highest risk of the complications for influenza, and that made great strides in our programs more generally, and has carried over to seasonal influenza. Last year, slightly more than half of the pregnant women in the United States were vaccinated, so we see this as the glass more than half full, but with work to go. So with that, just two other areas. I wanted to focus again on maternal immunization because in addition to influenza and pertussis vaccines, which are now routinely recommended in pregnancy, there are important vaccines in the pipeline for RSV and for Group B strep, for which we see the kinds of work that you're doing as helping to accelerate the movement of those vaccines, which are already quite along the way. So I think that attention there can get you a payoff pretty quickly in important vaccines that will protect, particularly protecting the babies of women at a time when they're most vulnerable. And then finally, back to influenza, is another important lesson we learned from seasonal influenza was that while our focus was on flu, it was also a revelation that adult immunization more broadly needed a lot of help. And we annually look at the CDC's statistics on how we're doing with adult immunization, and annually we think we need to do better. And we do need to do better, both in terms of vaccine delivery and some of the new vaccines that are coming. So we're in the process now of finalizing an adult immunization strategic plan that's going to take a hard look at that and give us some metrics to look at to try to improve our adult immunization program, as well as many of the others. But I'll just go back to the importance of the opportunity you bring here with your efforts. And I found that your description of discovery, development, and delivery is exactly what we're talking about, and how those continue to feed on each other. And I would argue that vaccines is probably the best case study for that, from vaccine to vaccination. And so I'm biased, but I believe that that's probably the best example we can cite. And we look forward to our discussions today and ongoing work here. Thank you.
Thank you, Dr. Gellin. I'd like to introduce Dr. Carole Hochman with NIH now.
Good afternoon, everybody. And again, I'm very pleased to be here. I'm not going to reiterate many of the things that my colleagues have said, but I just want to emphasize a few things. One is the reason that we're all here is actually we've worked together, as we've said, for decades. And we all are passionate about vaccines. We really believe that part of the value of our job and the reason that we do go to work every day is that we can make better products for all the people in the U.S. And we actually have had some successes, and it's really great when we have successes. So I can't do it without them, but I wanted to tell you a little bit about what we're supposed to be doing. we've really focused our attention on real basic research. And that forms the foundation for a lot of new discoveries which have led to vaccines such as acellular pertussis, the live attenuated flu, the conjugation technology needed to make pneumococcal conjugation. So some of those fundamental principles really came from the laboratories. And I don't want to diminish the value of the people in academia for really contributing to that, because really, I don't do the work at the bench. What I do is to find geniuses out in the community and figure out how to give them money to be able to do these kinds of concepts. And then we look really closely and see, are there really good nuggets of gold there that we can really further develop? And we then work with industry to say, hey, there's some really good ideas here. Let's try to figure out how to make this happen. But I can't do this without my partners. In some cases, industry doesn't have an interest, and that's, again, where BARDA comes in big time to really help on vaccines for which the public really needs some help with, as well as my colleagues at FDA and CDC to try to figure out how are we going to do this in the best way? What are the really important things that we need to focus our attention on? So the only thing I want to leave you with is that the basic research, again, very fundamental, early discovery, early development work, that's our space at the NIH. But it's getting harder. I just want to emphasize it's getting harder. A lot of the really easy vaccines are done, okay? We really have done a good job on this. And now the science is getting a little bit more complicated. The bugs are just a little bit more complicated. So there still is a lot of work going on there. You may not see a lot of things coming out, but believe me, there's a lot of work going on. So I want to thank you all again, and again, especially Representative Ulmers and Burgess for actually having this. It's great to be able to come out and talk about vaccines. Thank you.
Thank you so much, Dr. Heilman. I'd like to introduce Dr. Daniel Jernigan from the CDC now.
Thank you very much. I'm Dan Jernigan. I'm the Deputy Director of the Influenza Division at CDC. I'm here on behalf of Admiral Ann Schuckett, who cannot come today, but she wants me to send her greetings to you, Congresswoman, and to the other members of the panel. I also don't want to reiterate a lot of the same stuff that has been said, but we really are a group that has to work together in order for us to do the prevention that needs to get done. CDC is the nation's health protection agency, and we work 24/7 for protecting people from emerging health threats. Our particular center, the National Center for Immunization and Respiratory Diseases, is made up of a number of divisions that do different kinds of things, a lot of them focused on vaccine. The Immunization Services Division is the one that houses the very large programs that provide vaccines for people in the community through state health departments and through other agencies. The other divisions are really the scientific piece. And what we do at CDC that's a little different than others is that we're kind of there at the very front end. There's a front end that is the basic research that NIH does. There's the advanced development that BARDA does. But there's a determination of the disease burden that has to be figured out first. We have to know what is it that's causing the disease, how much of that disease is out there, what are the risk factors for it, what's the characterization of it, and that kind of information, along with the characterization of the pathogen itself, we then can hand off to other folks so that they can then develop those vaccines and then implement those vaccine programs. At the end of that, too, we also monitor the effectiveness of the vaccines in the community. And so those are things that we know that we need to do to make sure that once those vaccines are out there and being used, that the safety is still there, the vaccines are being effective, and that the diseases that they're supposed to be preventing are actually decreasing. So those are things that we want to make sure that continue. For influenza alone, this is a very big problem globally. In the U.S., there's tens of millions of infections that occur every year, hundreds of thousands of hospitalizations, and somewhere between 3,000 and 40,000 deaths that occur each year. That's something that really needs to be prevented, and it's a big program, and we have to do it every year because the virus is constantly changing. This year alone, 154 million doses of influenza vaccine from 7 manufacturers with 21 different products. So we have the products, we just now need to get the coverage up so that we can get that prevention that we really want to see. So we need not only to get the coverage up, but we want to also have some better vaccines. I think influenza is one of those that would really benefit from having a longer lasting, more broadly protective influenza vaccine. And we would love to see anything done that could help us get to that point. And then finally, we can't do what we do at CDC without the partners that we have at state health departments and at local health departments. If it's not for them and for the support that they get from us, we would not know about disease burden, we would not have the programs to immunize children, et cetera. So all of those things have to be taken into account, which are sort of on the bookends of a lot of the discussion that we'll be having today. So thanks a lot.
Thank you, Dr. Jernigan. I'd like to introduce Dr. Barton Hayes, representing Duke University.
Thank you. I'm Barton Hayes, Director of the Duke Human Vaccine Institute. The Duke Human Vaccine Institute is committing to developing products for society for current and emerging infections which are difficult to control and or for which effective vaccines are not available. The areas of research currently underway at the Institute are HIV vaccine development, pandemic influenza vaccine development, TB vaccine development, and Ebola antibody development. The DHVI has been at the forefront of HIV vaccine development for the last 9 years with the Center for HIV/AIDS Vaccine Immunology, or the CHAVI grant, from the NIAID, awarded to Duke in 2005. Over the past 9 years, the CHAVI team has defined the reasons an HIV vaccine has been so difficult to develop and devised ways to overcome vaccine development roadblocks. The Institute is now producing new HIV vaccine candidates based upon this work for human testing. Investigators at the Institute have also identified new targets for pandemic influenza vaccine development through, again, funding through the NIAID, and as well have made antibodies that are being developed as therapeutics for pandemic influenza for patients who fail flu drug treatments. For TB, it's important to note that a third of the world's population is infected with the tuberculosis bacterium, or TB. One of the most difficult diseases to treat is multiple drug-resistant or extreme drug-resistant TB. The Institute investigators are studying ways to target multiple drug-resistant and extreme drug-resistant TB and to make effective vaccines against these difficult-to-treat bugs. Now, with the recent Ebola outbreak in West Africa, the need for rapid development of new therapeutics and preventive measures is, of course, urgent. DHVI investigators have produced monoclonal antibodies against the Ebola virus outer coat protein in the past for diagnostic tests and are now preparing to isolate antibodies from both primates and humans injected with the Ebola outer coat protein as a vaccine to develop new antibody treatments for infected humans. Regarding the remarkable environment in North Carolina for this kind of work, the NC Biotech Center, companies and agencies in the RTP, North Carolina Central University, UNC, North Carolina State, and Duke make this area a very rich source of resources and for remarkable collaborations for all of these types of research. Our biggest challenges as vaccine developers in academia are the difficulty in getting clinical trials materials made quickly and cost-effectively, and the lack of funds for both basic and developmental work. As you know, and as has been wonderfully articulated here, vaccine and therapeutics development encompasses the entire spectrum from basic to translational research to product development. And it's the basic research that fuels new product development, particularly for these difficult to make vaccines that Dr. Heilman just discussed. A major problem for us is that the NIH budget has been flat for the past 12 years while inflation has increased at 2% per year. Thus, the NIH has lost 25% or so purchasing power in this time. This, in addition to the $1.5 billion loss in NIH funds due to sequestration, has negatively affected the upstream academic component of basic research for product development. So in summary, the 21st Century Cures is a very important initiative, and this symposium, I believe, is quite key, and I'm so pleased and honored to be here. Thank you.
Thank you, Doctor. I would like to introduce now